HHS, after a career as an entrepreneur in the private sector, was I met with Deputy Secretary Bill Core. He said, look, I'd really love to figure out how to leverage the power of HHS data to improve health in the country, improve community health, to help raise awareness of community health, and to help spark and inform action to improve it. Because HHS, it turns out, has just unbelievable amounts of data that it literally spends billions of dollars a year collecting from the CDC, from the FDA, from the NIH, Medicare, Medicaid, everything from smoking rates to obesity rates to hospital readmissions to cardiovascular mortality to access to healthy food, rates of mental illness, etc. And so this data actually largely sits in our vaults and isn't really used by anybody, which is kind of tragic. So Bill said, look, why don't we try to figure out a way to unleash the power of that to improve community health? Now, in a prior HHS, what HHS would have then done is published a map with all the data in it on a website, maybe, that no one would have seen, with zero impact. But this is not your mother's HHS. That's not how Greg Downing rules. That's not how Ahmed Bandari rules. So what we actually did instead was, we actually took a very different approach. We launched something called the Community Health Data Initiative. And what we did was we copied a playbook that had been perfected by an agency called NOAA. Does anyone hear what NOAA is? NOAA is the National Oceanic and Atmospheric Administration. Largely unknown to the American public until the recent Gulf mess. But NOAA, it turns out, supplies 99% plus of all weather data in America. So it's not like the Weather Channel has its own hurricane sensor network in the Atlantic. It's not like your nightly newscaster measures barometric pressure by hand herself, right? NOAA has networks of barometric pressure meters and hurricane sensors, etc., and just collects tons and tons and tons of weather data about what's going on that might impact America. Then actually publishes that data in an easily accessible form, increasingly XML format, free of charge, to the public, downloadable, without intellectual property constraint. And then what happens is the Weather Channel, weather.com, iPhone weather app builders, nightly newscast, pick up that data and turn it into applications, products, and services that benefit the American public. A profusion of products and services that NOAA could not possibly have funded or created itself, and they take advantage of the fact that, as someone told me very wise once, no matter who you are, you have to recognize that most of the smart people in the world do not work for you, right? If you really want to have an impact, you want to figure out a way to leverage all the smart people that don't work for you to realize your goal. So we said, look, what if we actually try to do the same thing? What if we try to position HHS as the NOAA of health data, right? As opposed to sort of creating the Uber app ourselves that no one would see, to actually make our data available, like the weather data, free of charge, machine-readable, downloadable, accessible to all without intellectual property constraint, and then market the bejesus out of that data, and have other people, much faster, much more creative than us, right, collectively, turn that into awesomeness, right? Turn it into applications and products and service insights that actually help inform the country about how to improve health. So we actually pulled together a meeting March 11th, much like this one, a little smaller, about 45 folks, who are public sector and private sector innovators, to actually brainstorm about this idea. And they were a mix of two kinds of rock star. Again, in the spirit of mixing, right? One class of rock star were people like Linda Bilheimer, or Don Berwick, or Ed Sonic, people who are just super deep healthcare experts, like Mick Jaggers of the healthcare world, right? They've forgotten more about healthcare in the last 5 minutes than I'll ever learn, right? Then the other class of rock star were people like Anil Dash and Tim O'Reilly, people who had never been to a public health meeting in their lives, right? But are geniuses at how you take data and change people's lives. And very tellingly, Tim O'Reilly had never met Don Berwick, didn't even know who he was, or vice versa, right? But they came together, and then magic happened. Because what we first did was we said, look, does this idea of HHS as the NOAA of health data make sense, or is it just like the dumbest idea ever? And they said, no, actually it makes a lot of sense. So then we said, okay, if it makes sense, here's a bunch of data that HHS could publish, or already has published, right? What kinds of applications could you put together with this that would benefit people right now? And over the course of the next 6 hours on March 11th, they brainstormed about 20 different classes of applications, community health maps, online games, analytical apps, decision support, etc. 20 different classes of applications that actually could benefit people right now, using data that HHS had right now. So then in the fit of kind of unconference impromptu improvisation, I, without totally checking with the secretary, said, I'll check with the secretary, but on June 2nd, the secretary, Bill Core, Harvey Feinberg, president of the Institute of Medicine, Anish Chopra, CTO of America, me and the HHS team will host a public meeting. And whoever one of them is can build one of the apps you just invented, right? We'll showcase you in a huge public meeting, webcast to make you famous, and celebrate what you've done. And we had kind of a private school auction where we had the different ideas on the wall and said, who's going to do that one? And people actually raised their hand, formed teams to start working on these, and recruit other people. A week after actually this marshmallow being, we published a bunch of this data in a form that was really easy to find and really accessible. And then 82 days later, on June 2nd, one of the most amazing displays of American innovation I've ever seen transpired. If you actually have a spare couple hours at some point, go to YouTube and search for Community Health Data Initiative, and you'll see the 2-hour session where 7 of the coolest apps that people actually put together that were either brand new or improved using our data were demoed by the teams. They were astounding. Absolutely astounding. And they were part of over 20 plus apps that were showcased that day. And just to give a couple examples, right, just because they're brilliant, right? So we have got this data set called Hospital Compare. People know about this data set, Hospital Compare. It's one of the coolest data sets in the world, right? It's this data set that Medicare compiles. It actually has hospital by hospital quality and patient satisfaction ratings. Really awesome, right? The way you really access this today is you go to an HHS website and you search for your hospital and try to compare it, right? Not a lot of people know about this website. Fewer people think it's usable, and basically the value of the data is, I think, not fully realized. So Microsoft Bing had this very simple and brilliant idea. They said, look, take the now downloadable hospital compare data set and integrate it into search. So if you type New York Presbyterian Hospital, for example, into Bing, it pulls up the patient satisfaction rating with the hospital compared to state average, right? So basically, instead of actually making people realize there's a website and making them go find the data, bring the data for people who are already looking for something that the data could help. They probably just 50x the social return of our investment in Compare, right? Another fantastic example, there's actually a fantastic partnership that's formed over the last few years between the National Association of Counties, a startup called Trilogy, and the University of Berkeley, a great collaboration of academia, entrepreneurship, and government. And they put together this thing called Network of Care for Health Communities, which is basically a community health dashboard that shows in layperson terms how your county does, or community does, versus key national metrics in a way that anyone can understand. And even more awesomely, it connects you to an inventory maintained by Berkeley of successful interventions that other communities have executed to move the needle positively on something you care about, like smoking. And it links you to an inventory continually updated of state and federal legislation that you might care about that would impact the indicator. And allows communities to basically share knowledge with each other about what they're doing that could be impactful. Because actually, as we all know, you don't transform healthcare in America, right? You transform health in America one community at a time. And there's so much experimentation, so much energy happening at the local level that isn't really widely known. That if we just tap into what's going on locally and have people share knowledge with each other about what's working, that would in and of itself be a revolution. And another example, I'll just give one more, is actually a startup in Boston created this game called Community Clash. And it's going to sound really silly to you, but it's actually really awesome and interesting. It makes a really good point. It's healthcare poker. So basically you pick a city like Boston, right? And you pick an opposing city like New York. And you dealt 5 cards each of which corresponds to a health indicator. Like smoking, obesity, access to healthy food. You actually, while the cards are face down, get to substitute 2 of the cards for 2 indicators you think Boston beats New York on. And then you show your cards, right? Now, it sounds a little silly, but I'll tell you what, of the 20 plus applications that were demoed at this event on June 2nd, everyone could go and check them out afterwards in the big kind of town hall kind of structure. The longest line by far was for this game. I played it for 3 hours straight with my wife, no kidding, that night, right? And I've been in healthcare for almost 20 years. I learned things about American health that were very fundamental that I didn't know. I learned that rates of mental illness in America are much higher than we would expect. I kept trying to find a city where the rate wasn't high, and I couldn't find one. And that will impact how I act and what I decide to do going forward in ways that I can't even begin to imagine. How many of you actually play Farmville? It's okay to admit that you do. Okay, so this crowd knows what Farmville is, right? It's this online social network, maybe Facebook, where you basically want to farm and trade sheep with each other, right? So does anyone here know, after about, what, a year and a half of development, how many active monthly users Farmville has? 73 million. Wow, right? I'll submit to you that if you're talking about improving awareness of health and community health in America, it is far more likely to happen with a health version of Farmville than by making Americans go listen to public health lectures on a website, right? So I think that the guy or gal who designs HealthVille, or its equivalent, will be one of the most important figures in this group for a moment, right? And that's something that actually excites me tremendously. And so, and the meta point of all this is that the government didn't do crap, right? The government just basically said, I got a bunch of data, and marketed it to the right people, and they turned it into magic, right? They really did illustrate the principle that most of the smart people in the world don't work for you, and they don't work for the government. But if you can harness their energy, right, you can do amazing things. So we're in the process now of basically taking the whole community health data initiative to the next level. So we're publishing even more data, which I can go into a lot more detail. We're actually mobilizing the ecosystem at a whole new level, and actually increasingly, the ecosystem is being mobilized not by us. So two of the most pivotal figures in this whole initiative are the great Matthew Holt and Indu Subbiah, and they had this brilliant idea, which they launched on June 2nd, which was the Health 2.0 Developer Challenge, which you can check out at health2challenge.org. And it's a beautiful, simple idea. It's a site where basically anyone can challenge the world to build the best app that does X. HHS actually has issued a challenge around the best app that takes our hospital and nursing home quality data and turns it into an app that's actually useful for consumers. Yville has issued a challenge for the best app that engages kids in health data. Robert Wood Johnson Foundation has issued a challenge for the best app that makes their county health rankings actionable. It goes on and on and on. And it's amazing. There's like 12 challenges on there now. We're going to announce the first winners at Health 2.0 later this week. And it's going to be an evergreen Health 2 Challenge forever site, right? Which is fantastic, right? And there's a lot of other stuff going on as well. Increasingly not choreographed, but even actually sort of something the government's aware of, which is exactly where we want it to be. We want the ecosystem to become this mushroom cloud of joy and mojo and public benefit that the government is just another player, right? That's enabled by the soil of our data, right? By the way, actually, private sector organizations are now starting to contribute data as well into this field. But with all the action, the thousand flowers blooming, being really totally out of control, right? Because that's the moment where beautiful things happen, is where there isn't a central intelligence, where there's a collective mojo flowing in millions of different ways to do incredibly cool things. 1 out of 10 of which, 1 out of 100 of which even, could lead to a good moment and truly be revolutionary. So I say that for two reasons. I talk about this for two reasons. One, this is a particular obsession of mine, open health data, the Community Health Data Initiative, mobilize the ecosystem. Two, I think that the whole process of how we've pursued it is how the government really wants to roll going forward, right? We see the government as a catalyst, as a member of a larger community, but not really as the driver, not really as a central actor, right? We see y'all as the collective central actors, and we want to do everything we can to help you rock the house, right, and save the world. So what I'd like to do in my session is basically, do a set of additional brainstormings around open health data and community health data initiative. Tell us what next steps we should take, or that we can help facilitate, that would actually help advance the ball on the world leveraging health data to change the world. I'll leave that open-ended, and my goal is to walk away with 3 things that I'll commit that we'll do as the government in some small way to be helpful in helping the world leverage the power of health data to change the world. So I guess just to conclude my unstructured remarks for this unstructured conference, I'm incredibly thrilled to be here today. I'm so excited to be here in the same room with all of you. I can't wait to see what happens. And I hope that today makes history. And I have every expectation, knock on wood, that it will, thanks to you. Rock on.